All right, sympathetic division. So now we're going to focus just on the pieces and parts of our two different divisions. So we'll go sympathetic first and then parasympathetic next. So again, this is our fight or flight region. We're going to get the body ready for action. It is also called our thoracolumbar division, so dealing with the thoracic and lumbar regions of the spinal cord. So that's where its nerves are going to exit out of the spinal cord. So with our sympathetic division, our preganglionic and postganglionic nerve fibers, the preganglionic ones are short and their postganglionic ones are long. So the neurosoma, or the main cell body, is going to exit out of our spinal cord, going out the anterior or front portion of our spinal cord. And it does that using the spinal nerve. So you already have a pathway going out of your spinal cord, so you might as well just use the same highway. So for our sympathetic division, our preganglionic neurons are going to synapse, or have our pass on that communication baton, in a series of ganglions that are near the vertebra called the paravertebral ganglia. So these are right by our spinal cord. So it's basically you exit out and immediately tag. Let's go again. So the preganglionic neurons going to synapse on these nearby paravertebral ganglion, so right by our spinal cord, and then the postganglionic ones are going to go to the target. So on the right side of the screen, you see all of these different targets for stuff that it actually can affect in the body. So we have targeting with controlling how much light you let in eye, your salivary glands. That's why sometimes, depending on your medication, sometimes if your medicine is targeting your nervous system, sometimes it causes your salivary glands to dry up, and then you end up dry mouth for a medication. Of course, we're getting the body ready for action, so increased heart rate, increased respiration, also having effects on the digestive system, so calm it down because we need to focus on our skeletal muscles. Also calming down our urinary system, so here's the kidney and bladder, and then some effects on our genitalia, for most of it just being with our, like, for example, your sexual response. Part of that is it's interplay between actually both of your different systems. And then over here, shutting down your blood vessels so you don't bleed out. There's also a little bit to our pileo-erector muscles, which are our hair follicle ones. That's why, of course, this doesn't work in humans, but for animals that actually have fur, that hair is going to puff up and then make them look larger, and so hopefully they're scarier. In humans, this is why we end up looking like a bunch of plucked chickens when we have like the chill bumps on our body, because of that muscle causing our hairs to stand up, so it doesn't have the same effect on us hairless apes. Okay, so there's different ways on bridging between the spinal nerves that were used to exit out of our spinal cord, and then getting to our preganglionic, getting to the ganglion and then exiting to get to our target. So one way that it uses is called the communicating rami. So that's these little thin branches here. So we exit off the spinal nerve, pass off our baton, and then go back to the spinal nerve. So it just forms a little bridge, just take a little side branch off of our travels, and then go back and use that same highway in order to get to your target. So here's I'll leave this in just because it looks so good, seeing your short preganglionic fibers with your longer postganglionic fibers, so that comparison is more easily seen in here. So that's why I keep it there. So red one being the preganglionic, the blue ones being the longer postganglionic. Okay, so with your sympathetic nervous system, you have multiple pathways. Instead of just leaving the spinal nerve, going to our paravertebral ganglia, and then going right back to the spinal nerve, there are different types. So going right back to the spinal nerve, sometimes going to a different ganglion and then exiting out, sometimes passing this ganglion altogether and then going somewhere else to pass off the baton. And then there's one more. Where's that last one? I forgot. There's another one that's a totally different pathway, but we'll cover it in the next few slides. Okay, so, she's only 3 routes. That's why. Okay, so the 3 I just kind of described. So you got 3 routes where we are leaving our sympathetic chain ganglia. So that is these paravertebral chain ganglion, so they are all connected together. That's why you're able to move from one and go to another to synapse and then move on. So for our 3 routes, we have the spinal, the sympathetic, and the splanchnic nerve. So let's focus on the first one. That is our spinal nerve root. So this is going to use those communicating rami to exit the spinal nerve, synapse, and then go right back to the spinal nerve. So the ones that use this, most of your sweat glands, the pileorectum muscles, so the ones that fluff up your hair, as well as blood vessels to the skin and skeletal muscles, since those motor neurons that also are exiting and using this highway are going to those areas, just for normal commands. The sympathetic nerve root is where your neuron uses the chain that connects our different ganglia, so using a sympathetic nerve, that's what these are called, using that to synapse, get to a different ganglion, synapse, and then you can pass it on. So for example, some of these nerves are going to exit out and form what's called a plexus. So again, we got all these wires hanging out in our body, so a plexus is a way to keep them organized. So basically it forms a little web. They keep everything together. So our artery is going to our generic location, so we just kind of keep going and create a structure so that we're also following that blood vessel. So just make it nice and easy. So this one going around the carotid artery, that's going towards your head, focusing on the sweat, salivary, nasal glands, pileorectum muscles, and then blood vessels in that area, as well as the iris. So in this case, our sympathetic nervous system, getting ready for some action. We want to make sure we can see as much as possible. So dilating our iris, so our opening of letting light into the eye. We see, well, at least we get more light in. And so hopefully we're seeing better. We can see stuff and protect ourselves in that situation. And then some go to the heart, so speed that sucker up. And the last one is the splanchnic nerve. So again, another one that just passes by the first ganglion, uses a completely different nerve to exit, and that's called your splanchnic nerve. So they reach their own set of ganglion called the collateral ganglia, and that's where they're going to make their synapse. So this one is just a little bit different, but same concept. Pass the baton, and then you pass that signal on to your effector. Okay, so with our collateral ganglia, again, keeping stuff organized. So for example, around your abdominal aorta, so we're going down south. So our aorta, sorry, you haven't actually covered this. Okay, so the aorta is your big, giant blood vessel that comes out of your heart, and it kind of arches around and then goes down and goes into your stomach region. So that blood vessel, when it crosses underneath your lungs with your diaphragm, which is the muscle that helps you breathe, once it passes that and gets to your stomach region, it's called your abdominal aorta. So it just changes name depending on where it is. So hanging around that, against using that structure in order to get to more lower areas, is just how it's arranged for these collateral ganglia. So they form their own plexus, their own webs of neurons, again, just keeping all the wires contained. So we have 3 different webs that we form, and that is the celiac, the superior mesenteric, and inferior mesenteric. So remembering from chapter 1, where we talked about the mesenteries that are around your abdominal areas. So that's just kind of referring to that area. And then celiac referring to the stomach. So remember people who have celiac disease, the people who can't have gluten, who actually can't have gluten, that's referring to a stomach situation. So they hang around those plexi until eventually they go to their actual target. So 2 of them, the celiac and the superior mesenteric, form what's called the solar plexus. I might be dating myself, but oh well. So the reason why it's called that is because the nerves, when they exit out of that ganglion, they exit out, they kind of look like rays of the sun. When I show you the picture, it's one of those, yeah, you kind of have to use your imagination. It's also the S from seeing in Miss Congeniality, where you're doing your self-defense stuff. So I'm going to show you where that is. So here is our celiac ganglia, and that's all in the same webbing with our superior mesenteric ganglion. So, oops, I did not put that on there correctly. Should be these 2. Anyway, so if you can look at it, it looks like you have your nerves coming off like rays of the sun. Again, yes, I said it's, you got to use your imagination a little bit. Okay, so when you're doing your self-defense, your kidneys, they are in your back. So when you are elbowing someone in the stomach, basically you're aiming for that area because that's a lot of nerves. And when you get any kind of disruption in your nerve signaling that is abnormal, your brain just determines it as pain. So that's going to be a nice, good, painful punch, especially since you're trying to punch through their entire digestive system to get back towards that. So it is very helpful. Okay, so with our sympathetic division, one thing that helps it work very well is a concept called neuronal divergence. So in this case, when we pass off our communication baton, so our neurotransmitter to our postganglionic neuron, instead of just having a one-to-one connection, it's a one to a bunch of postganglionic neurons. So this way you're able to have a really widespread effect across the body, able to target a bunch of stuff at the same time. There's also other issues that allow the sympathetic diversion to have a widespread effect. But neuronal divergence is one of it. So if you've seen the movie, it's been a while, the movie Divergent, where instead of staying in their classification, they diverge or split apart from where they're supposed to be. So this one preganglionic neuron is diverging or splitting into communicating to a bunch of other ones. Another thing that allows us to have a widespread effect on for our sympathetic division is the adrenal gland. So sitting on top of our kidneys, we have our adrenal gland that's showing it in pink. There's 2 parts of our adrenal gland. So I'm going to show you on the outside here where it's kind of gray on the outside of that pink. That's just what's called a capsule. That's just holding it into place. So in this first one is highlighting in pink the adrenal cortex. That's the outer layer, and that's making steroid hormones. So that is going to essentially kind of pump your body up and get it ready for action. It also makes some of your, like for example, your sex hormones after, for example, menopause, or in some people even andropause, where their stuff is slowing down. Your gonads, your sex organs, they just like, and I quit. At least you have at least some hormones coming from the adrenal glands. For the inside portion, the inner core, also called the medulla, this is where you're getting a bunch of different hormones. So 2 of the really important ones are epinephrine and norepinephrine. They're also called adrenaline and noradrenaline. So when those suckers are pumped into your bloodstream, it's going everywhere. So you've probably definitely heard of adrenaline, getting that adrenaline pumping. So that's going to affect your body and just really get it ready for action. So that's a big part of how the sympathetic division really gets things going. Okay, let's look at our parasympathetic division. So again, our rest and digest. So we're calming stuff down. So in this one, it's called the craniosacral division. So it's from the brain, cranium region, and sacral division. So down at the very bottom of our spinal cord. So the opposite situation for our parasympathetic is that it has a long preganglionic neuron with very short postganglionic neurons because the ganglion are either in the target organ, such as the heart, or they're very close by, very near to it. So long preganglionic, short postganglionic. With our parasympathetic division, and unlike our sympathetic system, very little neurodivergence. So instead of targeting a bunch of neurons, you only target a few. And again, this is because you're having more specific effects. Because instead of with the sympathetic division where you're just like, okay, everybody, it's time to go. Parasympathetic is making little small changes. We're just focusing, keeping everything calm. You don't need a bunch of hoopla. So, needing little effect, plus some of the targets to go to your effectors, those postganglionic neurons, they actually have a wide spread of where it targets, and so you don't need to target a bunch of stuff. So some of the main ones, we have the oculomotor nerve, so focusing on the pupil, such as narrowing it, so making it smaller, less light is coming in, that's going to help you calm down. So that's why instead of using your overhead lights when you're at home at night, using a lamp that's by your bed or, somewhere closer on the table, kind of mimicking sunset, but also it's going to have lower level of light and that helps to calm you down. Other ones, facial nerve, so it's going to focus tear glands, nasal glands, and your salivary glands. The glossopharyngeal nerve, another one of your brainstem coming off of nerves. The parotid salivary glands, that's another one. And then this is how it's able to really affect the rest of the body, and that is your vagus nerve. I can't remember if we already talked about this, but I'm going to say it anyway. So your vagus nerve is the nerve that's going to target your major organs. So that's how it's able to target all the rest of the same stuff that your sympathetic division can target. So here is our different targets. So again, the exact same targets, but completely different effects for some of them. So focusing on the eye, so less light coming in, salivary glands as well, decrease heart rate, decrease breathing, increase all the activity going on in your digestive and your, urinary system, which is a little bit split on this section. But here, let's get our, whatever we've eaten, making sure we digest that so we're ready to go for next time, get rid of waste, so get them out the way. And then also as part, again, of your sexual response, part of dealing with that. So with here, we have our long preganglionic neurons and short postganglionic neuron. Why? Because the ganglion are near the target organs. So again, my pretty pictures that I really like. So long preganglionic, short postganglionic. So these are super short because these are most likely the ganglia are actually inside the actual organ. Okay, the last one of this section, the enteric nervous system. So this one focuses on your digestive tract. So when you eat something, once you've done your first phase of swallowing, the rest of it, your body just takes over. You don't have to tell your stomach to break down your food into liquid. You don't have to tell your small intestines to digest and break it down so you can absorb it. You don't have to tell your liver to do its job, or the pancreas or the gallbladder or your large intestines. The enteric nervous system is going to do everything. So it does have some input from the central nervous system, such as you think about food, you see food, you smell food, you taste food. That's going to get your digestive system going. But it can work independently, and it does work independently of the central nervous system. So basically, even if you have a brain injury, you're still able to feed yourself as long as you can get it into your body. So it helps to regulate the motility in your digestive tract, making sure stuff is going toward the exit, making sure you get your different digestive enzymes going so you can break down your food. With your just normal function, even when you're not in the situation where you need to calm down or need to get ready for fight, you still have sympathetic and parasympathetic division having an effect on your system. So it actually kind of helps with balancing it. Okay. Okay, so for this next section, I'm going to skip around a bunch because there's a fair amount of this that isn't on the test. So therefore, I'm not going to cover it. That's why I'm going to be skipping a bunch of slides. So let's start skipping. Okay, so with our two different systems, again, they have contrasting effect. And part of that is because of the neurotransmitters that they use. So we're focusing on norepinephrine, which is for your sympathetic division. So remembering it's also called your noradrenaline from the adrenal glands, as well as acetylcholine for your parasympathetic division. So let's start skipping. So this is just talking about which ones are secreting acetylcholine, different types of receptors, what effects it has, blah, blah, blah. So some of the effects of how our sympathetic and parasympathetic nervous systems have is because of a shift of blood flow. So, for example, with our fight or flight sympathetic division, shifting the blood towards the skeletal muscles, it's going to cause a change in the size of the blood vessels. So, one way to change the blood vessel size is through vasodilation. So this is going to make your blood vessel larger, increasing the blood flow of your, increasing the blood flow of the area where you have dilated the blood vessel. So on our little yellow nerve, they're showing the tick marks are for action potentials. So we're able to cause vasodilation by decreasing the number of action potentials, decreasing the frequency of them. That slower frequency tells our blood vessels to dilate. This also can cause increased secretion into a gland, for example, the adrenal glands. Vasoconstriction is the opposite situation. So by speeding up the action potentials, a faster frequency causes the muscles around the blood vessels to decrease, contract, making the blood vessels smaller, therefore decreasing your blood flow or decreasing the secretion. So, for example, sympathetic nervous system, we don't want our digestive system and urinary system to be active at that time, so we decrease the blood flow to those areas. Okay, let's see how far we gotta keep going. Okay, so with our sympathetic versus parasympathetic. So again, using two different neurotransmitters. So with our sympathetic division, the effect tends to last longer because of using our norepinephrine, also called the noradrenaline. Part of it is just because norepinephrine sticks around. It doesn't break down like acetylcholine, and so you're able to have a longer lasting effect because you're still able to target your different effectors. However, with your parasympathetic division, our rest and digest division, the acetylcholine, remembering from even our muscle chapter, we're talking about acetylcholine esterase, the enzyme that breaks down acetylcholine. Acetylcholine is not going to stay around a long time, so it's going to have a shorter term effect for it. Okay, time for some more skipping. So this just goes into real to details and the receptor and the transmitter that they use. So again, with our two different nervous systems, they affect the same targets, but they're going to have opposite effects on each other. So even though they're targeting the same, they're going to have a different level of effect. So for example, parasympathetic has more influence on your digestive organs versus sympathetic more on what's called the ventricular muscle of the heart. So that is the, go back. The bottom muscle chambers of the heart. That's called your ventricles. So that muscle there, that's going to send blood either to your lungs, so you can go pick up some oxygen, or send the blood to your body systems, especially focusing on those skeletal muscles. Okay, so with the two different effects, again, the effects are going to be antagonistic or opposite to each other. So for example, differences in your heart rate, one's going to decrease it, so your parasympathetic, your sympathetic is going to increase it. Or sometimes you're focusing on the exact same section, but it's actually, so for here, you're targeting your pacemakers. on, for example, your eye, you're actually dealing with two different muscles, partially because the muscles aren't like doing both directions in constricting and dilating the pupil, so they have different targets. But they're going to have a opposite effect to constrict the pupil in the parasympathetic division, so less light coming in, dilating the pupil in your sympathetic division, so therefore more light is coming in. So just antagonistic effects are going to be opposite. So like we talked about the different effects. So they're just showing the difference in your eye, how much light is able to be let in that dark spot in the center. So just going over that. And then some of them, it's the same effect, just helping with, for example, increasing your salivary glands. I don't know why I left this, other than the fact I really like this picture. So with our different, yeah, so this is just focusing on looking at how our different divisions, specifically focusing on how it shifts blood flow. So again, toward the stuff it's going to increase, and then away from stuff it doesn't want to. And then this last section just goes over how our central nervous system can have an effect on the autonomic nervous system, but that's not on the test, so I'm gonna skip it. Okay, see you for chapter 16.